New this morning, the CDC director doubling down on the agency's confusing guidance for people infected with COVID and the amount of time they should stay isolated.
We at the CDC are 12,000 people who are working 24/7, following the science with its ever-evolving nature in the midst of a really fast-moving pandemic. And we are doing so, putting our head down to keep America safe. We will continue to update. We will continue to improve how we communicate to the American public. This is fast-moving science.
I'm still confused. As of this morning, the U.S. has now surpassed 58 million total COVID cases since the pandemic began. And 6 former health advisors to President Biden are now calling on the administration to completely change its COVID strategy from wiping it out to a new normal of living with the virus indefinitely. Joining us now to discuss, Sam Brock, live in hard-hit Florida, and Dr. Scott Gottlieb, former FDA commissioner. Scott, should the Biden administration be shifting their strategy that we're living with COVID, get used to it?
Well, look, I didn't take that article as an indictment of the current approach, but more a call towards how we have to change our posture going forward when this becomes the new normal, when this becomes an endemic virus. I think it's a little premature to envision what that's going to look like. We may face a virus that surges next winter and is a persistent threat, or it may start to recede. We may see a slowdown in these new variants. It may become less virulent as we build higher our wall of immunity. So I think calling for a strategy right now in terms of what that new normal needs to look like is a little bit premature in the setting of this current crisis.
Well, what's your take on the CDC's current guidance? Because a lot of people are confused.
Yeah, look, and the CDC didn't communicate it well. The issue of isolating only for 5 days and then being able to go back to work after 5 days, I think what the CDC is saying in that, what's implicit in that, is that they're recognizing that this is an epidemic that's not being spread by people who isolate for 5 days after a diagnosis and then go out into the public on day 6 or 7. It's an epidemic that's being spread by people who go untested, who aren't getting diagnosed. We're probably only diagnosing close to 1 in 10 actual infections right now. So this isn't an epidemic that's being propagated by people who get diagnosed, isolate, and do the right thing. So I think they're recognizing that. It is the case that fully a third of people after 5 days probably are still contagious. And so what CDC should be saying is that people, after they isolate for 5 days, need to continue to take precautions, and they need to make a determination what setting they're going back to. If you're going back into a healthcare setting or a setting where there's vulnerable people, you're going back into a household where there are people at risk, you need to recognize you may still be contagious. That's sort of a practical approach, recognizing that if you ask people to isolate for a full 10 days, knowing that 2/3 of them are no longer contagious, you're going to put a big strain on the economy when that's not the driver of the epidemic right now.
Sam, take us to Florida, because I'm sitting here in a New York newsroom talking about hard-hit Florida, and we know from your reporting how taxing this has been on the healthcare system. Yet I was in your state last week, and people are partying like it's 1999. I couldn't find a mask for miles.
You will see more masks now. I do have to say that, Stephanie, that's evolved over time. But yes, only New York has added more COVID cases in the last 2 weeks than Florida. Nomi Health gave us a really inside look into what they're doing in terms of testing here. It's the largest contractor in Miami-Dade County. As you can imagine, Stephanie, they have been plenty busy. What they're doing here is nothing short of remarkable. Somewhere in the neighborhood of 40 to 50,000 PCR tests a day in this county, and then another 20,000 rapid antigen tests as well. Over my shoulder, you're going to see there are these 6 containers. This is where the bulk of the work is being done. They look like prefab homes. They go up in a matter of 72 hours, and there's 6 stages to how this works. Nomi Health takes those samples from a testing site, couriers it over, then it goes to one of those containers. It's in there and logged and digitized into the system. The lab technicians then take out a small portion of that sample. This is called aliquoting. I learned that word yesterday for the first time. They then extract the RNA from the COVID sample and can test to see if it's positive. Now, the genomic sequencing for all this doesn't happen here. That takes place off-site. I spoke with the co-founder of Nomi Health, Joshua Walker, about what role they're playing right now in public health. Here's what he had to say.
Well, for us, it's been, even from the beginning, we felt that part of testing, accessibility to testing was both clinical, which is you're symptomatic and you need to know, but it's also economical, right? It's helping us all return back to some version of normal life. If you are worried about access to care, that slows the economy down, that slows your life down. I mean, if you look back at the worst parts of the pandemic, some organizations where it was taking 2 weeks to get a result, you can't put your life on hold for 2 weeks. It has to be in 24 hours, 48 hours.
Steph, Nomi says that in a 5-day period in December, they went from seeing virtually none of the positive tests linked to Omicron to more than 90% of them linked to Omicron. And I should add one other thing. There's no live virus in here. They have chemicals in the solution of the vial that is, as soon as the COVID sample is introduced, deactivates the virus. So it's safer for everyone as they're going through right now at a strenuous rate and trying to figure out if folks are positive. Increasingly right now, it's about 30 to 35% of all the samples, Stephanie, that are coming back positive.
Scott, I want to ask you, have you gone back to relatively normal in how you live your life? When I look at my own family, we're vaccinated, we're boosted, we have access to testing, so we're close to back to normal. How are you living?
Yeah, look, I'm not back to normal. I don't think you can be back to normal in an environment like the one we're in right now. It's a very high prevalence environment. You look at Florida, for example, Miami-Dade County has over 400 cases per 100,000 people per day. A lot of counties in New York and New Jersey, where I am, also have that level of infection. At that level of infection, you can't be doing things like you normally do. The bottom line, though, is that we are seeing cases peak in Florida and New York right now, and New Jersey. They're peaking probably right now. That's going to be more discernible as we head into next week. And this epidemic is going to move to other parts of the country, the West and the Midwest. But this is going to come down as quickly as it went up. And hopefully on the back end of this, prevalence remains low in the spring and the summer.
Dr. Scott Gottlieb, thank you for joining us, and Sam Brock.